Christina Bauer with Healthcare for the Homeless. Our poster here is talking about community partnerships and how we can advance access to quality care through collaborating with different people across the community. So this one in particular is with CareFirst, Healthcare for the Homeless, and Enoch Pratt. So our partnership is rooted in our community health work. So community health workers were supported by CareFirst to really ensure people had access to the quality care in the way that they needed. So that's a variety of different ways, but really the bridge to care with client escorts to appointments, really transportation, anything that folks needed. That's how our community health workers are able to bridge that gap to care. And thanks to CareFirst, we were able to enhance that work for years to come.
Awesome. Thank you, Christina. And you are? Come on in. Hello.
Hi, I'm Amelia Brandt. I am a program manager with the public health team at CareFirst.
Oh, very cool. And what was the partnership like between CareFirst and Healthcare for the Homeless to develop and present this information?
We came up with a 1-year grant to help get this started because we could recognize the need. But it's not just enough to have the services that Healthcare for the Homeless provides, which are amazing, but you also need to be able to help people get access to the other services, and the community health workers will want to help make that possible. And then it was also highlighting a very amazing partnership with our colleagues at Enoch Pratt Library. And so this is just kind of 2 of the ways that we work with different partners in this area to help people experiencing homelessness. And we are really proud to be able to partner with such great community organizations.
Well, thank you so much. Now, how are you today, sir?
Barry Johnson.
Good. Nice to meet you all. So tell us a little bit about Enoch Pratt and what's the role that you guys played in this partnership.
So the Enoch Pratt Free Library is one of the oldest libraries here in this nation. And the library is one of the last free democracies where people can come in and get all types of great services and resources. So with this grant through CareFirst, we were able to train 45 peer recovery specialists to get their certification, and then they get on-site workforce development training at the library where they're working closely with the librarians, people that's coming into the library seeking services around mental, behavioral, substance abuse. So this is all a part of our great wraparound services like social work in the library, our partnership with the Mayor's Office of Homeless Services, where we have housing navigators, lawyer in the library to Maryland Legal Aid. And we have about 6 to 8 branches where we have all of these great wraparound services.
What's one of the more forthcoming outcomes that you have seen so far?
There's a lot of outcomes. You know, having people with a lived experience that's back into the work field and seeing their glow up, you know, getting a paycheck, coming to work, you know, they get a car, they're leveling up this program, getting a job at Johns Hopkins or another organization, and just being back out there amongst the working people, and then also giving back by doing the work that they're doing to individuals that were once in the same space that they were, that share that lived experience. I mean, I'm Baltimore homegrown, so I know that. I started off at the library as a part-time security officer. So for those peer navigators that's in this program, giving back to the community, but also steadily just growing and developing and evolving and bettering themselves.
Thank you so much, Will. All right, you're in here. It's all about bringing the services to the people, meeting them where they are, and then materializing tangible outcomes that help them to live productive lives, giving back, coming full circle. We're right here at the National Healthcare for the Homeless Council annual meeting in Baltimore, Maryland. All right.